Fit4Surgery is a study that we did in patients with ovarian cancer who are over 60, receiving neoadjuvant chemotherapy. Patients with ovarian cancer often come with high symptom burden, lots of tumors in the abdomen, and they're undergoing a really large debulking surgery that has a lot of risk of complications. We were trying to see, can we improve their physical performance and fitness prior to surgery so that they do better? We called it sort of patient-tailored goal setting. So what we heard in a lot of our initial patient interviews, patients don't want to come in for extra visits. So the program's really designed to be delivered to them at home. It consists of a commercially available Fitbit, the Fitbit app that uses symptom burden tailored goal setting, and a weekly coaching call. The symptom burden tailored goal setting basically means every day the app asks the patient, how are you feeling? Kind of 1 to 5. Based on how their symptom burden is, it will offer them subsequent goals based on their previous day's steps that either nudge them up if they're feeling well or nudge them down if they're not feeling as well. This again is based on data that patients really have cyclical symptom burden that happens around the timing of chemotherapy administration. This was a pilot RCT of 30 patients with the main goal of just trying to figure out if this is feasible. Our feasibility endpoints were really designed around, one, are people going to do it? Are they going to drop out or are they going to engage? And the exciting thing is we found it was very feasible. We did find that 90% of patients completed the entire program, so we had about a 10% dropout rate. One of those was actually for enrollment in hospice, so that's an idea of how symptomatic these patients were. We also had really high rates of use of the app, adherence with the Fitbit. Those were all 95% of days in the study. Patients were engaging with the app, using the program. They attended 97% of their coaching calls. The one thing we found that patients struggled with a little bit more is they kind of set their goals a little bit higher than was realistic. So goal attainment was only around 50%, but all of our other measures of adherence were really high. We found that patients who received the Fit4Surgery intervention increased their average daily steps by around 2,000 steps from the start of the program to the end of the program. We did see also improvements in patient anxiety, pain, and quality of life in actually both groups over the time of the study. We enrolled this study not at just our downtown campus, but also throughout our entire health system. And a little over 50% of the patients who enrolled in Fit4Surgery and completed the study were not downtown. What we're really interested in doing with our decentralization is trying to bring trials to patients where they are and also make sure that a broad sort of swath of representation is present in the patients that we study. That's important not only for them, but for us and for the results. Is this really going to work in the real world? We don't know unless we test it in the real world, and that's part of what we're trying to do through this health network approach to clinical trials.